This is just to run through a few different instruments. Scissors, for example, 3 main types. Iris scissors for more precision work. They can be rounded or they can be pointed. Then we've got the Mayos, which are for muscle. They should have a rounded tip on each side, so there's less chance of causing any damage internally when you extend your linear alba. Metz and Balms are slimmer, finer scissors, just different lengths, these two. This one's gold handled, so it's tungsten carbide, so it's more durable. The steel's a lot stronger, so they say sharper, longer. They can come in curved or straight versions. Direct dissection forceps. Adsons are this specific shape like this, and they can be with teeth or without teeth. Straight dissection scissors, dissection forceps, again teeth or without teeth. The wider ones are better because they're less traumatic. So for example, if you grab the intestine with the Adsons, the force on there could cause some damage, whereas if you've got a wider, broader tip to it, there's less damage caused. And that's where the curved ones can come in, because you can hold like that, cause a lot less damage. So I'll use these, for example, finding the other side of the uterus in a cat spay, and I'll then sort of hold the uterus like that, so the forceps don't cause any damage. Alice tissue forceps, not often used. I tend to use it for sort of holding things in place. For example, in the castration, I'll sort of pull the testicle out and clamp it like that, so it keeps it sort of extended out. So not really, I don't really see them often, but can be handy in cat spays and dog castrations. Then we've got lots of different hemostats. Just roughly to go through, we have some like this, which you probably won't see much. These are Kelly forceps, and they're serrated here, and then the serration stops there. So this bit is very atraumatic, so it's kind of its advantages. Your mosquito forceps are just a lot finer, and you can always have straight or curved versions, and they can come with teeth. Generally I'd avoid teeth on artery forceps because it could cause damage, so I'd never really use. Now this one's small like the mosquito, but it's actually Rochester pain because it's a lot more serrated, so a lot more traumatic as a clamp. And this is just a larger version, curved. The main use of the curve is so it goes away from the body. So for example, if you were clamping an ovarian pedicle, the curve would prevent you catching the skin or fat or whatever in the clamp. Now this one's similar, but it's called a Carmalt clamp because it's got the very smooth lines going down like this here, compared to the Rochester, which is a lot rougher. So for example, if you're placing that on your ovarian pedicle, it's going to cause some damage, whereas the Carmalt clamp will cause a lot less damage. So it allows you to move the clamp up and down, so it's a far safer clamp to use in a bitch spay. This is just to show you another mosquito, even though it's a lot bigger than the general mosquito. It's because it's got the small tip, and again quite atraumatic. And then we can go to the other extreme, which is an angiotribe. So you can see how this locks the tissue inside and seals it. And very rarely seen, but can come in handy. Sometimes you can use these in bitch spays as the last clamp because it'll give you some extra seal at the end. These are just Spencer Wells, which are like the Rochesters. This one here, this is an intestinal clamp, a Kocher clamp. got the same sort of lines as the Carmalt clamp, but it's very atraumatic. I clamp it on my finger like that. So the idea of this is that it can hold the intestine without damaging it and close it enough to stop intestinal fluid coming through. So if you're using two clamps like that, where you're surgically operating here between,